We're back with an important today's checklist. May is High Blood Pressure Education Month, and a lot of folks, well, they don't really know what their numbers mean. So we've brought in an expert. We've got internist Dr. Kavita Aggarwal to help us better understand our blood pressure and the impact on our health. Dr. Aggarwal, first of all, my apologies for butchering your name at the beginning there. But welcome back. So let's start off with the basics. What exactly is hypertension? What does that medical term mean?
And that is a very good question. So hypertension is having an elevated abnormal blood pressure. And first, let's talk about what blood pressure is. Blood pressure is actually the force of blood running through the arteries of your through your body. And you're probably aware that your doctor records it as two different numbers, a top number and a bottom number. The top is systolic, the bottom is diastolic. And the American College of Cardiology and American Heart Association have put out different categories of what is normal and what is not. So you'll see a chart, and you'll see that
There's
normal.
The chart on the screen right there.
So a normal blood pressure is a systolic less than 120 and a diastolic less than 80. Elevated blood pressure is where the systolic is between 120 and 129, and the diastolic is still under 80. Then we have stage 1 hypertension, where your systolic is between 130 and 139, diastolic 80 and 89. Stage 2, 140 or higher, diastolic 90 or higher. And then that last category, I do want to note hypertensive crisis. If you ever find your pressure in that zone, I would just kind of relax.
Yeah.
You know, take a breath,
Sure.
recheck your pressure, and if it's still that high, call your doctor immediately.
Okay.
Yeah.
These are good. One thing I know to be true, there are people I remember growing up, oh, my blood pressure's high. And it almost becomes so many people are talking about it that you're almost immune to it.
Yeah.
But I think it's important to talk about the risk factors.
Yeah.
It's not just something to throw around.
No,
you know?
it's not. And, you know, genetics really matter. If you have a family history, you have a higher incidence of developing high blood pressure. Gender and age matter as well. There's a slightly higher risk among men, and then they develop it typically at a younger age, women over the age of 65. And then also there's a higher incidence among the African-American population.
So then let's talk about exactly diabetes, kidney disease. I mean, things come from this.
Yeah, so there are certain medical conditions that physiologically can increase your risk of developing high blood pressure, such as the ones you mentioned, diabetes, kidney disease, and sleep apnea.
Okay.
Yeah.
So, doctor, let's say you're not at the doctor and you're at home. How can you check your blood pressure to make sure it's okay?
Right. So typically the diagnosis of hypertension is made at the doctor's office, but there are certain circumstances where your doctor will want you to check it at home. Like, say, you have white coat hypertension where you're a little anxious at the doctor's office and we want you to check it at home where you're more relaxed and calm, or we need more data points. So there's a lot of different monitors out there, and I would like you to check out the website validatebp.org, and it has a listing of different monitors that are accurate and reliable.
Okay.
And again, lots of different monitors. You want the one that is a bicep cuff monitor. I brought in my own monitor today.
Okay.
You want the cuff that sits on your arm, not the ones on your wrist or finger. When you're checking your pressure, you want to make sure that you avoid smoking, drinking caffeine, or exercising for 30 minutes prior to checking. You want to choose a seat that has a supported back and where your feet can be planted on the ground so you have good support. Have a table next to you that's at heart level, and support your arm when you check your pressure.
Okay.
Remove the clothing from your upper arm, place the cuff on the arm, and then just kind of sit and relax for like a minute or two, because we want you to be relaxed. Yes, exactly. Check your pressure, and again, these monitors are super easy. Just a hit of a button, and you can get your number.
Okay.
Check it again 2 minutes later, and then talk to your doctor about the results.
Perfect. Great.
So, doctor, let's say you do have hypertension. What are some of the negative impacts that this causes?
And again, just like we said, hypertension is one of the leading causes of vascular disease. And as this graphic depicts, it affects multiple organ systems in your body. So it can cause atherosclerotic heart disease. So that means, you know, increased risk of heart attacks, congestive heart failure, kidney disease, peripheral arterial disease, and strokes, vision loss too, exactly, and sexual dysfunction. So it really can affect a lot of different things.
And then, so you have this. What are some of the ways to prevent that elevated blood pressure, or at least, you know, try to mitigate it if you do have it?
Right. And again, you know, about half of the adults in America have high blood pressure right now. So this is an important topic to talk about. What can we do to prevent it? So first and foremost, having a healthy diet, lots of fruits and vegetables, whole grains. You want to limit the amount of saturated fats, lean proteins. Limit your sodium intake to less than 1,000 to 1,500 milligrams a day. Cut your caffeine intake, quit smoking.
Alcohol.
You want to have regular exercise, 150 minutes of
You just lost
cardio a week.
Greg on that one.
Okay.
Yeah.
Gotta get my blood pressure checked.
And stress management. There's such a big connection between mental health and physical health, right?
And no
So
tobacco.
Yeah.
Don't smoke.
Yeah.
Cut down
All the things we know to do,
Healthy
we hear it
things.
every day on the show. It's just a matter of doing it.
Doing it.
Yeah.
We
Thank
can
you,
do it.
Dr. Aggarwal.
Thank you
so much.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.